Why are we talking about the breath work, and how is, let's say, even heart rate variability involved?
Yeah. So one of the biggest things that we can directly see change with right away is our heart rate variability and how we can improve that via breath work. So
Mm,
when we are nasal breathing, we are improving our vagal tone, which
mhm,
then is improving the parasympathetic upregulation. And when we have good parasympathetic upregulation, we have a high heart rate variability, which is a good thing. And we've talked about, I think just in our recent pod, a lot about heart rate variability.
Yes.
So if you guys want to learn more about that, please go back to that
Mhm,
pod. So what I want to take you guys to take away from is how we recover and how we train ties heavily to heart rate variability. And one of the
mhm,
quickest and most powerful ways to impact that is with breath work. And so one study showed that just regular slow paced breathing increased heart rate variability and vagal tone, which shifted from sympathetic to parasympathetic state using just 6 breaths a minute.
Wow.
And it also in this study showed that patients had better stress resilience, cardiovascular recovery, and emotional regulation. This was a study in 2014. So again, I think you're going to start to see so many other things symptom-wise that you are going to see changes in just using breath work alone. And that's what really excited me as I started to dive more into these research.
So with this study, is that they're purposely just trying to take 6 respirations, just breaths in that
Slow.
minute
So
time frame?
you're looking at least probably 2 to 3 second inhale and like a 10-second exhale, because that'll get you roughly about 10 to
Ooh,
13 seconds
should make
a,
sense.
a full breath, and then do that 6 times. That'll get you to a minute. Is my guess.
Which
It'll be
would,
close to that.
especially if they're having their like awareness and attention just on trying to create those 6 respirations, those 6 breaths. I can see how you're trying to like slow down your breath,
For sure.
which kind of makes sense with calming the system down a little
And a
bit.
lot of patients are poor breathers and
Mhm.
never really practice breath work. And so it might be difficult for some of you to practice this. You might feel like you have a weak breath. You might feel like you can't control it. And it's probably going to be worse if you're in a state of anxiety or
Mm,
stress, because we tend to having a tougher time breathing when we're
mhm,
in a state of panic. The sympathetic system is upregulated, and
mhm.
now we're shallow
Yeah.
breaths. Again, brings back to doing that for a long period of time, become chronic. We can limit the expansion of the ribs, talk about just how much that can
Mhm.
impact our performance, our range of motion, movement. And Doc and I were just working on a little exercise to even just diagnose something like that. And then how breath work can improve just the rotation of the spine, things like that. And we'll probably give you a little bit of an exercise at the end here
Yeah.
to see what we were doing, because Doc's range of motion improved by about 30%, and it was in 10 seconds.
That's
Just,
incredible.
yeah, off of 10 breaths. Yes, super excited to continue to explain this to you guys.
Dr. Addy, Dr. Jace, the AJ challenge. Stop right now. Start a timer. Try to take 6 breaths in. Can you complete that?
Yes.
Is going to be the question mark.
And
Leave comments below.
if you can't, we got work to do. No
Yep.
worries. We'll teach you how to prove that.